I have been surprised not by the intensity of the reaction to those who are opposed to healthcare reform. I have been surprised, though, by the insanity of their approach. I mean, we were talking to some folks just before I came up about all of the fear-mongering from the death panels and so on to healthcare. Let's be very clear. If we do nothing on healthcare, we will continue to see our costs go up by more than 10% every year for the next 10 years. That means also that more families will lose their health care, and that we will continue to be less competitive when we compete overseas, because we put the cost of our health care, of course, on the shoulders of so many of our companies who are competing overseas. It's an unfair advantage for them, certainly an unfair disadvantage for us. Now look, this isn't just about these stats. There's a woman who lives about 10 minutes from here. She had her kids early and went back to work, but her job, her company, didn't offer insurance. And so she kept going, and she'd feel ill from time to time, and she wouldn't go in. And then finally, after 10 years, she gets a job that is unionized, and she gets insurance. So she goes into the doctor, and on her very first visit, diagnosed with cancer. Now, she was one of the lucky ones because she actually caught it in time. Now, she ended up having a hysterectomy, but she survived, and she is still working. Her kids are well, and she's one of the folks who actually made it through the system. But think about the hundreds of thousands of families, the millions of families who don't have access. What do they do? Where can they go? So, in my view, the focus absolutely has to be on lowering costs for folks who have insurance, but also expanding coverage for those who don't. Now look, there's a strong connection between the two, right? We're seeing more and more people get pushed off the healthcare rolls because the costs keep going up. So we've got to control costs, expand coverage, and I would also add we have to focus on outcomes more. We're finding that some of the best practices for saving lives are not being widely used, and so depending on where you live, your health plan, what hospital you go to, you may not be getting the best coverage. All of these things will make for a better system. You certainly can't tell me that every other industrialized country in the world has figured this out, and we can't do it. So we've got to fight for that. And I've been an early supporter of the public option. I'm going to keep fighting for the public option. This is absolutely the right policy for our country.